Hi, my name is Dr. Raj. I am the chairman of Overseas Point Impal. Manipur Labour Nahol Singh Aduga students in Makoida Matamasanaba Ivadi 21st Century Employment Market and Demand of Skills in Makoida Pisanaba Adugi Professional Service Pirinabida Overseas Point Impal Link Money. Aduga quick mission that see Zanana Equina regularly Manipur Mapan the Tokraba Ivadi foreign Malay Kraba from Manipuri professionals sing Makoi sing interview lower and Makoi labor ideas and experiences Makoi do Manipur Ginaro singer students singers hair to Nabagida Mutai Quina program as it of Z high work interviews sing say Quina Akoigi YouTube channel Manipuri diaspora the upload to Tamzi Adana Nasisi Akoi we have got a very special guest from Canada, Dr. Amuchou Soraisam. Welcome, Doctor, to Overseas Point.
Thank you so much.
Welcome to Manipuri Diaspora.
Thank you.
Dr. Amuchou si Pediatric Doctor ni adok ma sedagi Canada sakraga Haji University of Calgary da Associate Professor Oinalai aduga Atopa Health Center Amadasu Parts Medical Director Oina Pubiri aduga mana Canada chatting da India dagi MBBS aduga MD Pondicherry dagi toki adugi matungda amuk neonatology da PGI Chandigarh dagi loisalaga aduga momitangda Canada da fellowship loduna chatkibani ana Canada da ma adumagi professional side there is a long line of titles including FRCPC
Yes.
From Royal College of Physicians and Surgeons Canada FRCP
FRCPC.
What does that mean, Doctor?
FRCPC is a fellowship, so Fellow of Royal College of Physicians of Canada. So that's for those who are in medicine. It gets the FRCPC. And those who are in surgery, then they are called the FRCS.
And then I have another question. What is neonatology?
Yeah. So neonatology, how do we see pediatric brands of many haitar? The first 28 days, the specialized care. For example, is heavy as 500 gram. Lumba nang the paunama lumba dagina full term babies ta any acute intensive care the karta bahata sore from the sore hondre atra brain function tawdre dumain to bese nang che popaga kapte haiba nang leidana dugambasi intensive care da phuna care pibani. Neonatology is a field of pediatric brands.
Thank you. And Dr. Amuchou si Canada the magi professional association gi thabak sudum pi aduga social issue marks Manipuri Association Canada gi hana president in Pubirami aduna yamna Manipur gi damta de yam chauthok chana yoba adugumba misak amani Calgary city ko Dr. Nanzi lebi se Calgary city is in India Canada one of the most livable cities.
Yes.
Ranking #1 for many of the years at the moment. So how's your life in Calgary?
I think overall life is quite satisfying, I should say, both from the social life, professional life, as well as the environment. So, I think as you have heard, Calgary city is a world cleanliness city and so mamang the tar not only the livable yam the pesa paidra su yam na paidra at least living standard of na high on living pom it's adamalere duga nangi school gi khangbe dagi tabak tabagi khangbe duna nungai na leba mapam ni haita
Vancouver dagi pangabat mane
Vancouver dagi pangabat Vancouver dagi Calgary bose pung amakatani flight lambi on chata di Calgary ga Vancouver was maybe about I think one day that would cover the
1 day. Oh, okay.
Car to masa tak.
Oh, okay. So wala pa na. Okay.
Yeah.
Okay. Yeah. Aduga yam na power pumi yam mayor mo sila ni the Calgary City. Mr. Nancy.
Yeah, Nahi Nancy is the current mayor of city of
And he himself belongs to an immigrant family, right?
That's
From
correct.
Tanzania. And so, yeah, I think that's typically the story of Canada, right?
Yes.
Immigrants are very, they are very well positioned.
Right.
Okay, so Manipuri community di kamay tawi Calgary aduga Canada
So hojik ko ni yeng abada koi Calgary city da atare ko le si koi 11 families lai ko duna koi si ngai bamna koi si yam nat na lai min nei samna da city si yumam de yum da tasing na koi le min ri me am do minute tra tra ma da leng jo ba ya go yum ma to en le nakalam da punna le min re aduga hai si loina yam bana la aga thabak tawani dana anang so hojik da le pa anang ge hojik college ka ba yaura BSc first year second year yo yaura habidi hanadi am pikna yara me do matam high school ko tung da disum tam sa nang tung chawak panina
moiduna second generation immigrants ka do ni
man
okay yeah
the mina
okay so you are a busy doctor so how do you describe your typical day in Canada
So Canada da ko si doctor si makalya me haitar same profession si da so aina hajagi habadi so IC University magiri associate professor ang lenglay bani satra su tai patient su yengi research su tawi administration su pai okay so in a single day so if I am a clinician haitar ko doctor mo na patient wo ta nimit thok pat haitar ko so maina ko gi weekly different roles so let's say aina samna habida koi NICU habida neonatal intensive care unit ta tabak tawani between 7:30 to 8 sida koi yawda bayate aduga heg yawga wari koi gi night ta duty ta doctor me am dagi ngarang dang bogi da kari progress le dage aduga handing over se lawre habidi ndang gi progress me am do anang me am dagi do koi da sinare habital aduga adagi de koi na tamisi university makham da Lainina kogi pediatric residents lay neonatology da tamba specialty hai tare ko du fellows later adu me am da tawaga koina anang me amsle ni yengani ko kogi team da lay da duga first year na ko plan da lay matung da morning rounds hai tare ko usually about 10 o'clock we decide to go for rounds so kogi rounds da matam sida chat si doctor gi group yawjare dagi de nursing so bedside anang do being a nurse aduga nurse ki in charge haitare adune the pharmacist dietitian ko je punna team mamo oina salaga ko ge bedside to bedside rounds to the interesting thing is that we allow the parents to be during these rounds they can ask questions regarding their babies so it's like what we call as a family integrated care haitare ko koi parents in yaraga yahon naba admain tawreba tuga khara adu rounds le matum badgi then as a part of the rounds sudum teaching tawre du leraga tungana lunch break haitare ko rounds le matum da tawaga khoi gi afternoon sida su satra mayam si lak panina duga mufam maga muk like ta tukta sin kari patient du related oba mayam du tak minare then before we sign out haitare ko night taba ko group to the night duty taba yawi ko some neonatologist some suyawani aduga ko resident na fellow ani maga night duty taba se ko mo team du dagi handing over lawani na by about 4:35 we get the handing over then the team starts for the night so
the work life balance comment away is it very tough to the family
no I think generally it's a pretty good head that koi India da sutar panina yeng da kogi night duty ta drabodi koi night duty is maybe 5 to 6 nights on call haitare ko as a faculty so man live nina pung manga da isina night duty le drabodi handing over to matung na mama pa ko wari ga sana le de aigi ngasi duty lo then after that is your time
okay
so with the family that probably so you don't have to get called Okay, and if it's a night duty, akwai kai tare samna habda akwai na house Calgary the city is the policy. There are 5 intensive care units for babies. We call NICU. Adina, there are 28 neonatologists like consultants. Then we have the trainees. So, and then at least for each hospital there will be one consultant on call. Adina, kayumba nangsi IC nang tare haibodi round the patient yamsa yung maga. Kogi sat kogi fellow maga resident amgadi in house lega doini adu tawga akwesi yum dahan bayar aduga nang da moina report pirakani natraga say for example 26 weeks angang bopokani haitar body moi inform tawga I will go back to the hospital. Yeah, so some nights we expect that we will be going, but other days when I'm not on call, I'm with the family, I can have my social life, so it's pretty good.
Yeah. So and then compared to the life of those colleagues, your colleagues, who stayed in India. So how do you compare? I mean, their lives and your life there.
So in India also, I think it depends on in India. I think who's working in the government sector and who's working in the private sector. Generally, they have seen how our lifestyle is there. Some of them have come to Canada. And people seem to be very busy here. It's under a rat race, I should say. Going from one hospital to another.
Busy in Canada?
Here.
Here.
The reason is, I think, sometimes it may be wrong, but I think people are going from one hospital to another hospital as a private practitioner. So sometimes you forget about your family life here. And sometimes it's very hard to find them. Like if I know that, you know what, my friend is coming for the next thing, I can plan it ahead. Here it's like every evening, so morning you go for work, or even before you started your hospital work, people have the clinic in the morning, you go for your official work, come back, then you have an evening, I don't know, some people, seems like doing lot of busy clinical practice as a private practitioner. So in Canada we don't have the private practice business. So I'm dedicated to the hospital I'm working.
There you go.
So that's what the difference is.
And in terms of healthcare delivery. So do you see any difference that in India and the one in Canada?
Yes, there is quite a difference in the system, because I have worked in Pondicherry in Jimmer as a resident, and I have worked in Chandigarh, right? And then after that I have worked for a few months as a faculty in India. So the difference is that in Canada it's a single payer system. So what a single payer system means, everybody will get the same kind of treatment. Doesn't matter whether you can afford to pay extra money to see a doctor or not. So for example, we have a universal healthcare system which is given for everybody who needs the basic necessity for medical care.
You're talking about Canada?
Canada. In India, as we all know, you have abundance of doctors here. The people can choose whom they want to go for it, right? As long as you have money, you can go to private and get things done. You go to government, at least you get the basic care. So there's a difference in the way we provide care here. So that is one. So this here is something like a 2-tier system. If you really look at in a global perspective, I think India is like a kind of 2-tier system. People who can afford to pay, they can go and get the service quickly, for good or bad, I cannot tell you, but sometimes if you go sudden emergency, sometimes surgery which may not be needed immediately may get performed sooner because you can pay it off. But in the Western world, so in Canada is a single payer system. Everybody who gets emergency care will be done irrespective of whether you can pay or not. However, they also have a drawback. Sometimes, for example, for elective surgery, you may have to wait for a specific time. Wait time. So they have got a longer wait time.
Yeah.
That's maybe one issue. And second other thing is that, say after hours, for example, say after 8 o'clock or 9 o'clock, you may not find a doctor in a public system, so you have to end up in going to emergency. Unlike in India, you can go at 9 o'clock, 10 o'clock, you can find a doctor who is doing private practice.
Yeah.
As long as you can afford to go, afford to pay, you can go and seek your help.
Yeah.
But in Canada, after that hours, probably the best place is to go to emergency. So sometimes emergency can clogged by so many people.
That happens quite frequently.
So even in emergency, it's not like the who came first gets in. So it's about, they have a triage system. So the sickest person will be seen. Doesn't matter whether you came first or last.
Okay.
So sometimes when you are sick but not very sick, you may have to wait for 2-3 hours sitting in emergency. Okay. Sometimes we laugh. If you have a fever and going to emergency, it's better to wait sometimes at home, because sometimes while waiting in the ER itself your fever comes down.
Okay.
But I think that is how they triage between the two things. Okay. So it has got both pros and cons in either direction.
Yeah. Okay.